Okay.
Hey everybody out there, we're back. It's Beautologie Facebook Friday. It's myself, Dr. Milind Shah, the medical director at the medical spas over at Beautologie, and we're so happy to have our audience back again with us for another awesome Friday. We're almost winding up our work days today, and we're over here today at the Petroleum Club. We're at the 12th floor. We got this beautiful view behind us. We're broadcasting live off-site today, and what we're talking about is something a little bit different. We've been doing procedures the last few visits with Facebook Live. Today we're going to talk about medical grade, prescription grade skincare. A little bit different, but still very, very important. And what we have today, what I brought with us today is our prescription grade line at Beautologie. We have our Beautologie Skin Transformation System. And this is a wonderful line that not only really turns back the clock just by itself, but complements a lot of different things we do at Beautologie. Complements our laser procedures, our facelifts, our injectable procedures, and it really just kind of puts everything together. And so we're going to dive right into that, but I wanted to kind of throw it out there. If you guys have any questions, our audience, we love our questions. I always forget to answer everything that's top of mind that our audience usually brings up, and so I want to make sure you guys are very active. Anything goes, whether it be about the product line or procedures that we do or how this works with procedures. Sky's the limit, so please ask away. And of course, we have a lot of great things we're announcing today. We're going to be announcing our winners for the cryo treatment that we talked about last week, the facial cryo that tightens pores and gives you that endorphin release. Well, one of our lucky Facebook fans has already won that 1 week. And then we're also going to be announcing the winner of the prescription grade skincare line. We're going to give away a 5-month system of the Beautologie Skin Transformation line to one of our lucky viewers today. So we're going to announce that. We have a few other announcements, right, Heather? Who else is winning today?
Yes. So we are announcing our 3 Beauty Bash winners from our most recent Beauty Bash yesterday. And then, of course, we'll be giving away the skincare kit to our lucky Facebook fan who's done an amazing job sharing this with her friends. So that's coming up. So everyone needs to stay tuned. Dr. Shah, we're gaining our viewership. So why don't we just welcome them back? We're live here at the Petroleum Club, and it is Facebook Friday with Dr. Shah.
It's Facebook Friday, and thanks so much for joining us once again. As I mentioned, today we're going to talk about something a little bit different. We're not going to be doing a procedure, but we're actually going to be doing a skincare system. We're going to be talking about our Beautologie Skin Transformation System, which to me is actually just like any medical grade procedure. Other than it just being, it's more of a long-term approach to going after the skin rather than those short-term quick in and out treatments that we offer at Beautologie. This is something that really keeps the skin really nice and healthy, and it's something that really kind of turns back the clock over the course of a few months. So let's talk about medical grade skincare. There's skincare is available in so many different forms. You could go to the mall and buy skincare, anti-aging creams, moisturizers. You could go over the counter and purchase creams that promise to maybe turn back the clock, go after lines and wrinkles and dark circles. With medical grade skincare, the difference between medical grade and cosmeceutical grade, which is kind of everything else, is medical grade stuff has to be thoroughly tested. It has to be tested, on a large amount of patients. We call them double-blind studies. They have to be studied, underneath the skin. We actually have to take portions of the skin and look at them under the microscope to see what this is actually doing to the skin. But most importantly, the FDA, the government or authority that actually makes sure that this stuff is safe, has to approve medical grade or prescription grade stuff before it's released to the public. And so we have to know that it is effective and also very, very safe. As opposed to cosmeceutical grade, and there's great cosmeceutical grade stuff out there, but really a lot of the stuff out there, there's claims that are made, and it's really hard to know whether those claims really kind of come to fruition. And now with medical grade, there are a lot of things that have been tried and true over the last decade or even last couple decades. As we all know, sunscreen is extremely important, and sunscreen, whether it be cosmeceutical or medical grade, is an important ingredient that you have to add to your daily routine. It is one of the top anti-aging creams out there. Being medical grade, we're making sure that these sunscreens are good for your skin. Now, they're not just protecting you from the sun, but they're also not affecting your skin in a negative way. In our Beautologie line, we actually offer a wonderful mineral-based sunscreen and something that has great UVA and UVB protection. We've talked about this in the past through some of our talks, but what UVA light is, it's the light that actually can destroy your skin. It's the light that actually can age your skin. It's the light that actually can cause cancer. The UVB light is also not good as well. UVB light from the sun is what causes your skin to burn. All too often, a lot of sunscreens out there just protect you from the UVB light, which means, you know, you're not burning, which is great, but unfortunately, you're also letting all that UVA light come in. Well, using a broad spectrum mineral-based sunscreen that has some great ingredients will protect you against both. And so you're not getting that burn, but more importantly, your skin's not aging and it's not going to be harmful. We're not risking getting the different various forms of cancer from the sun as well. So that's one of the important ingredients. But let's dive into some of the medical grade ingredients that are part of the Beautologie line. One of the biggest anti-aging creams out there, other than sunscreen, if there was truly an anti-aging cream, is Retin-A. Retin-A has been around for many, many years. Retin-A is also common. Dermatologists will commonly prescribe it for acne in young kids. But Retin-A is truly an anti-aging cream in that it's really turning around the skin. It's getting rid of that top layer of skin and it's bringing out some healthy new skin in its place. Retin-A is a prescription grade medication. It's something that we have to definitely monitor. The Retin-A that we use in our system is the higher percentage, is 0.1%. It comes in 0.1, 0.05, and 0.025. Well, we're using the strongest prescription Retin-A in our system, the 0.1%, and it's something that is used fairly regularly, at least once or twice a week. Initially, we actually get a little bit more aggressive and use it nightly. The Retin-A in our system is going to turn over that skin. It's going to get rid of that outside layer of skin and bring out that healthy new skin. Being a vitamin A, basically, having that nutrient available as that skin exfoliates is going to ensure we have our best chances in terms of getting some great new skin to the surface. And so Retin-A is a great component and a wonderful component of this system. Another prescription grade medication that's in this system is hydroquinone. Now, we all have probably heard of bleaching cream one way or the other. Hydroquinone can be called a bleaching cream. We're not necessarily bleaching your skin with hydroquinone. What hydroquinone is really doing is it's going to overactive pigment producing cells in the skin. When we have sun damage, when we have sunspots, when we get that hormonal pigmentation in our skin, commonly referred to as melasma, these are all overactive pigment producing skin cells. And what hydroquinone is doing is it's going to those overactive cells, we call them melanocytes, and telling them to relax, stop making so much pigment. And by doing that, we're essentially lightening up those spots, lightening up that patchy pigmentation. We're even lightening up scars that shouldn't be there, scars from acne, scars from just being injured on the skin, dramatically with just using this hydroquinone or this lightening cream. In our system, we call it our Vanish cream, and it is an essential ingredient. Now, it is something that does a great job. It's a workhorse. It does quite a bit in terms of getting rid of that pigmentation, but sometimes that pigmentation is embedded a little bit deep down. And so although the hydroquinone will help tremendously, it might not get rid of all of it, in which case we start working on the skin a little bit more aggressively with our chemical peels or laser peels, something that's going to go after that deeply embedded pigmentation along with the hydroquinone. I'll keep going, and if you guys have any questions, Heather, just let me know. If there's any questions that come, feel free to totally interrupt. It's totally fine.
We do have some commentary, although not questions, but
Okay.
certainly positive things. So Pavan says, awesome. He's clapping his hands. He thinks Dr. Shaw is on point today.
Thank you.
Gloria paired her products with her Clarisonic Pro, and she's never had so many compliments on her skin. Thank you, Gloria. We love, love, love you, and we love Beautologie Skincare. We're glad that you ditto that sentiment.
Great, yeah, and we'll talk about pairing some of the other therapies along with this system, like the Clarisonic, which I think is a wonderful addition to the system. The other main component of this system is a glycolic acid. We use glycolic and lactic acids in the system to help exfoliate the skin. We want to get rid of that damaged skin up top. We want to get those embedded wrinkles and lines brought up to the surface and then basically exfoliated. We want to get rid of those open pores. We want to get rid of some of that pitted acne scarring, any kind of textural issues, but we need some help. And so what we do is we add in a glycolic acid in our system over here. It's our number 4. It's called Remove. And what that helps out with is in the mornings, if there is some sloughing off of skin or a little bit of peeling of skin, this is going to help loosen it and get rid of it a little bit quicker. And speaking of the Clarisonic brush actually goes wonderful with the system because that is also helping to get rid of that dead skin that's wanting to come off a little quicker, which makes it a little bit more tolerable using the system, and especially early on when there is a little bit more exfoliation. Using that Clarisonic brush along with it really helps jumpstart stuff. Not to mention it's going to help the products absorb a lot quicker. It's going to really clean out those pores and really help these products get down deep to where they need to work. So the glycolic acid, again, a really important component. A few of the other things we add to the system is stuff that we use anyways. It's cleansers, toners. We want to make sure we're using a nice cleanser, something that's not too perfumey, something that that will irritate the skin, something that just feels really good and really cleans out that oil. And so we put our foaming cleanser right here at the beginning of the system. It's called our Refresh. Patients really love the scent and they love the feel. It's really not really scented, but just feels nice and fresh. And so that's our Refresh. And the toner is really important. It's our second product here, and our toner is pH balancing the skin. All too often we put on all these creams on our skin, and if our skin is too acidic or too basic, it's not balanced, the creams aren't going to work. So one of the most important steps is to first of all pH balance that skin. And so everything works the way it's supposed to. Not to mention that the toners also help to close off some of those pores as well. So using the stepwise approach really prepares the skin, really activates the skin, turns it over, exfoliates the skin, and then really brings out that healthy new skin up underneath. And wonderful results. Our patients will usually see results, well, it's starting to work within a couple of weeks, but within about 4 to 5 weeks you're seeing some great results. Within 2 months, excellent results, and about 4 to 5 months, that's when you kind of see your max benefit with this system.
So Dr. Shaw, we're gaining our viewers, so to kind of just give them a brief statement about what we're talking about today and why they need to stay tuned.
Absolutely. So thanks for joining us. For those of you that are just coming on board, we're with Facebook Friday Live, and we're at the beautiful Petroleum Club up here on the 12th floor. And today we're talking about skincare. We're talking about medical grade skincare, prescription grade skincare, and why it's so important to be on a regimen that's really actively going after that damaged skin and bringing out some healthy new skin. We brought out our Beautologie skin transformation system, and we've been going through a few of the main components of this system, along with a few other things we've been talking about. So welcome, and again, please ask any questions. One of the things we're going to be doing towards the end of the program is announcing all our winners. We have a lot of amazing prizes that we're giving out, including one person that gets to win this system as well. So that, and for those that submitted during the beauty bashes that we had yesterday and last Thursday, we're going to be announcing those winners as well. So please stay tuned.
So you guys, just interjecting a bit, if you have trouble with acne scarring, with hyperpigmentation, even fine lines and wrinkles, this system is totally for you. It's going to address everything. It's a one-size-fits-all, so it really and truly is great for everyone. So Dr. Shaw's going to touch on that a bit, and kind of some similar products and why this is truly, we think, and I think it's true, the best skincare line out there.
Well, thank you. Yes, absolutely. We have a lot of different things that we can go after with this system, beginning with this system. And Heather just mentioned fine lines, wrinkles. I was talking about pigmentation earlier, acne scarring. With textured skin, whether it be imprinted lines or wrinkles, or deep acne scars, or pores, it's about getting rid of that texture, getting rid of that textured skin, and then bringing out some of that healthy new skin in its place. And that's what we're trying to do with this system. One of the main things we're trying to do with this system is get rid of that damaged layer of skin, exfoliate that skin. And we have to do it deep down. We have to get rid of almost that entire top layer of skin, the epidermal layer of skin, for this to be effective. There's great procedures out there like microdermabrasion and just using loofah sponges at home, exfoliating the skin at home. Now with medical grade, we can take it a little bit deeper down. We can go after the entire epidermal layer of skin with this. Not to mention we're infusing that skin with vitamins, so when that new skin comes out, it's just going to be in the best shape possible.
So first and foremost, thank you, Pavan, for sharing this video. We think Dr. Shaw is amazing, and he's great to really educate us. So I'm I'm so glad you shared it. I think everybody needs to hear this. And Dr. Shaw, Leanna is asking if there is a product for under eye puffiness. Welcome, Leanna.
Thank you, Leanna. That's a great question. These products can be used fairly close to the eye. We got to be careful with the retin-A we were talking about, not getting it right on the lid itself. Some of the exfoliation that we're doing will help with some of the fine lines around the eyes. It will help kind of exfoliate some of that skin underneath the eyes, but right up against the lid itself, the upper lid, the lower lid, we have to be careful not to use something too aggressive because we are working close to the eye after all. We have a wonderful cream. I don't have it here right now, but it's called our Be Complete Eye Cream. And what the Be Complete Eye Cream is, it's a cream that we formulated several years ago, and we kind of found the best eye creams out there and what made them the best. They're great creams that work for under eye circles. There's creams that work great for lines and wrinkles. There's great creams that work for elasticity. And what we found, we isolated a lot of the ingredients that help elasticity or puffiness or lines and fine lines and wrinkles, and we put them all together, hence the name Be Complete. Some of the ingredients in the system are copper, ferrous sulfate, caffeine. These things are going to really help with that puffiness. We're going to maybe, actually not only exfoliate that skin, but really kind of draw out some of that water and also help a little bit with the pigmentation that you get with that puffiness, those dark circles. The Be Complete cream is actually not a medicated cream, although it is something that's part of our medical grade facility. It works great with the Beautologie system. It's something that you would use morning and evening. Within a few weeks, patients see that they're noticing a difference. Within a few months, great results.
So Dr. Shaw, while we're talking on that, why don't we just go ahead and dabble into under eye puffiness? I think a lot of people suffer from it. We have a lot of patients who kind of bring that to the table. So if we could just dabble into that a bit more for Leanna,
sure,
that would be great.
So up until a few years ago, I should say, if you have those deep set eyes and the bags underneath the eyes, surgery was really the end all be all. Where our partners at Beautologie, our facial plastic surgeons would basically get rid of some of that excess skin and maybe fill in some of that hollowing with some of your own fat from another part of your body. Well, as with everything, not everybody has the downtime, even though there's not a lot of downtime with that surgical procedure, but they don't always have that downtime. So what are some of the things we can do non-surgically to go after the eye area? Well, one of the things we talked about already is using the skincare. Using the skincare, we are able to kind of turn over some of that older skin, some of that damaged skin, some of that sun damaged skin, I should say, and bring out healthy skin that's going to be tighter, firmer, and more even tone in appearance. But there are a few other things we could add to the mix. We talked about adding procedures to this. One of the things we can use is a skin tightening laser. We have a laser called our Illuma radio frequency laser. It's a laser that actually stimulates collagen, a laser that wakes up your collagen, jump starts collagen production, and by doing that, we're again bringing out tighter, firmer skin. This is doing it, that's going to take it a step further. It's an in-office procedure we do at both of our locations, and it's something that doesn't really require a lot of downtime. You're a little red after the procedure, the redness fades within a day, you're back to your regular routine. So that's an amazing adjunct to the skincare. Something else we do to fill in that hollowness, the what we call the tear trough area underneath the eyes, those, to go after that sunken look. That's usually hereditary, is using facial fillers. We have a wonderful product called Restylane Silk. It's a product that is part of our hyaluronic acid family of fillers. It's a finer filler that's used in that thinner skin area. And what it does is by filling in that hollowness, we're bringing that back up to the surface. We're making it more even with the skin below and the skin above, making that area more even plane, and so that hollowness is not as apparent. A great non-surgical procedure, a quick fix, something that you see dramatic results with. The downtime is very minimal. Now, there is some bruising that can happen because it is an injectable procedure, but the bruising can be covered up with makeup, and usually bruises go away within a week or so.
So So Dr. Shaw, we have some new viewers, so welcome new viewers. Miriam wants to know how old you have to be to start on a medical grade skincare line. Great question, Miriam.
Thanks, Miriam. Wonderful question. So, actually, the skincare, other than being over 18 and not being pregnant or nursing, I say, anybody can be on this medical grade skincare. Now, it depends on what we're going after. For our younger patients, usually it's acne scarring that we're going after. And when we see acne scarring, and even under 18 with parental consent, and of course of us doing a proper physical exam and making sure they're a good candidate for it, we could even go younger than 18. But generally, with our younger patients, it's the acne scarring that we're going after when we're starting a more invasive medical grade line like this. Now, getting into your 20s and 30s, usually we're starting to see that hormonal pigmentation, that melasma starting to develop after having kids. And so that's an age group that we see utilizing this system, or a different form of this system to go after that as well, the melasma. And then as we get into our 30s and 40s, the sun damage starts to creep up, the lines and wrinkles start to creep up. And so again, we're using a form of this system to help with that as well. And then, of course, we have patients, again, all the way from as young as 15, 16 up until their 80s or even beyond that, they're using the system and deriving the benefits in various versions.
Dr. Shaw, we have some new viewers, so let's welcome them to our Facebook Live broadcast. We are live with Dr. Shaw here today on Fun Friday.
Thanks, everybody, for joining in. We're having a lot of fun. Thanks, Heather. And this is a little different. We're actually at an off location today. We're at the Petroleum Club at the 12th floor. We got a beautiful view of Bakersfield in the back over here. We're talking about awesome new stuff. We're talking about our skincare and everything that goes along with it. So thanks so much for joining us, Facebook crowd.
If you guys have not been to the Petroleum Club, this view is insane. We can see all of Bakersfield. So what better way to host our Facebook Friday? So we're talking about Beautologie skincare line today. So Dr. Shaw is just going to review a little bit about what we've been talking about thus far. We're so happy you're joining us, and we can't wait to tell you about the Beautologie skincare line.
Yes, so the Beautologie skincare line, we've had it in our practice, for over 8 or 9 years. It's came to fruition about 8 years ago through a lot of kind of trial and error and try to figure out what the best stuff is for the skin, what the best medical grade skincare we can incorporate into our daily routine. And we came up with this system. We have several thousand patients that are so happy with the system. I myself use the system, and I absolutely love it. It's something that really helps to not only go after damage, not only go after pigmentation, fine lines, wrinkles, but really it's very preventative too. It prevents us from having to do some more aggressive or invasive procedures sooner than later. And so there's a lot of great benefits by going on a prescription grade system like the Beautologie system.
All right, so we love your questions, Facebook. So we'd love to hear from you and hear the questions you have regarding the skincare line or just about skin in general. So we're gaining our viewership here, and we are talking about Beautologie skincare line.
So again, thanks again for joining us, all of us. So let me kind of go into a little bit more of other things that would work well with the system, or how the system kind of prepares your skin for more aggressive procedures. So a lot of times patients will come in wanting to go after deep lines and wrinkles, and so lines and wrinkles that they've acquired over the last not just 5 years, but we're talking 10 or 15 years. Where we're having to do our deeper laser resurfacing procedures, our lasers like our CO2 laser resurfacing procedure. Now the CO2 laser resurfacing is a wonderful treatment. We're taking off the entire top layer of skin, the epidermis, and we're heating the dermal layer of skin, which gives patients wonderful tightening. We're seeing patients in terms of lines and wrinkles go back not just 5 years, but even more when we're talking about turning back the clock. One of the things we got to do when we're going after the skin with something more aggressive like the CO2 is prepare the skin. And how do we prepare the skin? Well, we use a system just like this. When the skin is healing, it's going to need all the nutrients and vitamins it can get. So using things that are part of the system, like vitamin A or retin A or vitamin C, are those essential nutrients that are needed. And having those nutrients available, that collagen is going to remodel much better. we're going to see great results. So again, using the system prior to these laser treatments is important. Another thing that we see with laser treatments, and although it's less and less common with the advent of more sophisticated lasers, is side effects, such as a side effect in particular called post-inflammatory hyperpigmentation, or PIH for short. What that is when we're taking off layers of skin, as that new skin comes out, we have overactive melanin cells or overactive pigment cells. And one of the risks of these laser procedures, especially in darker skin patients, can be pigmentation, actually getting pigment from the laser. Now, it's a very small risk. It's usually less than 8% with even some of the most aggressive treatments. But when we use the creams that are in the medical grade system, the hydroquinones, the retin-A, we're again relaxing those pigment cells. And so the chance of getting a negative side effect to a laser it drops down considerably. It makes those laser procedures so much more safer. So when we're doing these laser resurfacings or even a photofacial, I always incorporate at least a portion or a component of the medical grade system into the patient's routine a few weeks before the procedure, and it just makes the results so much better. The other thing it does is it protects your investment. When you're doing these laser procedures, again, we're really turning back the clock. Well, what's to prevent all this stuff from coming back in a year or 2 years or 5 years? Well, using the system again, keeping that skin nice and exfoliated, using the retin-A or the vitamin A as a nutrient to constantly stimulate that collagen production is again going to protect that investment. So it's something that we always recommend.
So, Dr. Shah, we have Michelle watching all the way from Canada.
Hi, Michelle. Thanks for joining us.
Michelle is saying she's been a patient of yours for 7 years.
Michelle,
they used to come in 2 or 3 times a year, and they've moved to Canada. They have not found anyone as good as Dr. Shah. Michelle, we love that.
Thank you, Michelle. We really miss you, Michelle.
Yes.
I hope you're having an amazing time in Canada. Thanks so much for joining us today. And hey, anything we can do for you, Michelle, mailing you out the products or any information we can give you, we'd love to do that.
And Michelle, we know you might need a vacation to good old Bakersfield soon, so you know where to find us.
Yes, we'll love to see you back in town, absolutely.
So, Dr. Shah, while we're addressing kind of that hyperpigmentation and the excess pigment in the skin, I think a concern of most people is that they have what they call brown spots, or they think it's they call them sunspots.
Sunspots. Sure, brown spots, sunspots, sometimes they're called age spots. Medically, they can be called solar lentigines or solar keratosis. There's a few variations of this pigmentation, but really it's the UVA light that's physically changing the architecture of the skin, activating some of that pigmentation, and leaving these stains that we see on the surface of the skin. And so what do we need to do to get rid of those? Well, the best way to go after brown spots are either burn them away, bleach them away, or peel them away. We're doing 2 of those 3 things right here with the system. We are bleaching, so to speak, relaxing those pigment cells, so we're lightening that pigmentation, and we are starting the process of peeling them away. We're using the retin-A and the glycolic and lactic acids to gradually exfoliate that skin. So with just a system, we see a lot of lightening, and I do recommend that we use the system along with the lasers because the number of maybe laser procedures we might have to do dramatically decreases, not to mention all the other benefits you get from the system. Now, if those pigment spots are definitely buried a little bit deeper, or there are a lot of them, then we would do something like a photofacial treatment or a photorejuvenation treatment to burn them away. We're using light therapy to burn away cause a control burn of this pigment, these brown spots, and by doing that, we're exfoliating them away as well. So, great question. We see a lot of sun damage, especially in California or just the greater Midwest, and so using a system like this, along with some of the laser procedures, really helps to kind of turn back the clock.
So, Dr. Shah, who's a good candidate for this system? Who should use Beautologie skincare?
So we do have variations of the system. We have our Beautologie acne and acne scarring system. We have our Beautologie skin transformation system. We have a toned down version for even younger patients that want to just keep their skin nice and hydrated, and they want to prevent against getting some of that, the premature aging. And so really, it's almost for anybody. The only restrictions with a lot of our cosmetics or medical grade stuff is that you can't be pregnant or nursing. Of course, you are off limits with those. We have to make sure you're a good candidate. There's no medical conditions that prevent you from being on a system like this. As long as all that checks out, you're a good candidate. Now, of course, if you're younger and you're looking for more prevention, we wouldn't hit you as hard as we would, say, for patients that are going after more of that real deep down sun damage. If you have acne scarring, we would add in a component that would help a little bit more for that oily skin as well. So we do tweak the system for a variety of different age groups, but anybody that's looking to turn back the clock, get rid of scars, or really just kind of even be preventative is a good candidate for the system.
So Diana is saying skincare is absolutely important, and Diana, you are so right.
Thanks, Diana. Appreciate that.
Why is skincare important, Dr. Shaw?
Skincare is so important, and it's something where we're out there. We're Californians, or just again. Or from Canada, we're out there. We want to enjoy our weather. We want to, enjoy that beautiful sun. The environment does unfortunately take a toll on our skin, and so we got to protect ourselves while we're enjoying ourselves. But then, with that aging skin, we want to have something that is going to help kind of be our defense, our shield. Something that lets us get out there even more often without having to worry about that aging, and that's why that a medical grade skincare is so important.
Absolutely. So, Dr. Shaw, we have a couple of new viewers tuning in.
Hello, guys.
So welcome to
Welcome,
Facebook
guys.
Friday. We are talking about Beautologie skincare line and why it's just simply amazing.
So, I do get a lot of questions about, how difficult would this be? And it does seem like there's a lot of stuff out there, a lot of stuff on the table. But I'll be honest with you, it's not as bad as it looks. So, a lot of our patients will use a cleanser and a sunscreen, or a cleanser and, say, a moisturizer anyway. So, basically that's like a couple of the steps, and so, the cleanser is right here, and the sunscreen we could kind of call like our moisturizing type of cream, but it's really our physical block against the sun. So that's, 2 easy steps. And really, we're just adding 2 steps to the morning and 2 steps to the evening. So we have a cream that helps to get rid of those spots in the morning, and this is it's the same one that you use in the evening. And then in the morning, we're using that product that helps exfoliate the skin. And in the evening, we're just using that Retin-A, that vitamin, to stimulate the skin. This little cream here is just an extra cream that's used the first week or two as the skin is actively exfoliating. It helps kind of calm down some of that reaction if needed. So really, we're talking about maybe 4 steps in the morning, 3 steps in the evening. Pretty simple. Once you see the results, once you start seeing it work, it just almost becomes self-reinforcing. You just want to kind of do more and more of it because you're seeing those amazing results, and that's what we usually see. And being on medical grade, we're always with you. We're not going to, unlike, say, going to the mall or the pharmacy, we're not just selling you this product. We're going to be on top of it. We're going to make sure you're getting good results. We take pictures along the way. We want to show you the results that you're getting. We do tweak some of the products, maybe go up or down in the dose, the interval, depending on the results we're getting. And so that's what you get being on medical grade system. You get that medical follow-up, which is so important.
So, Dr. Shaw, I think we are just about closing out Facebook Friday. So we are going to announce our winners.
Wonderful.
So we have from Beauty Bash, first and foremost, our ticket winners are 506, 062, 506, 213 and 50568. So you guys have won some amazing Beautologie swag bags, in addition to some awesome treatments that are in those as well. So congrats to you winners. Our last week Facebook Live winner for the Cryo Freeze facial treatments was Sammy Joe. Sammy, we loved your engagement. You were so fantastic, and we're so happy to award you with those treatments. So, and then we have our grand prize winner, Dr. Shaw, for our Beautologie skincare line.
Oh, I'm excited. Who is it?
Drum roll.
Here we go.
The winner is Jackie Rangel Santiago. You go, Jackie. Thank you so much for all your tags. You tagged just under 40 friends with this Facebook Live post. So we are so thankful for that. We thrive on referrals from happy patients. And we can't wait to start you on your Beautologie skincare line. So see us Monday. We can't wait to see you. Dr. Shaw, anything else that you want to tell our Facebook Live viewers other than thank you, thank you?
Thank you so much for joining us for a wonderful Friday again. It's so wonderful having you guys, and I love being on with you guys. I hope you guys have a wonderful weekend. I think we're going to have a great time here tonight at the Petroleum Club, and so thanks again, and we hope to see you again next week.
Maybe not. We may be hanging on, guys. We may be hanging on.
That's okay. A few extra minutes is totally fine.